Thank you very much for participating in this conference and giving me the opportunity to present you what we are doing. I'm going to speak about transforming healing with the new awareness, an awareness that want to create medical doctors that are guides, and we want to increase the therapeutic awareness of the patient. So, first of all, I want to present myself. I'm Dr. Nikos Chatzibalassis. I am a naturopathic doctor from Greece. I live and work in London, and I have been trained I have a BA in naturopathy. I have been trained in homeopathy for many years. I have a postgraduate degree in homeopathy, and I also had a great research on the human biofield, and based on that I have a PhD and a big experience for thousands of hours of assessments with my clients. So all this led me to where I am now. But I want to tell you how everything started, my journey. I was a young teenager, 23, when my father was diagnosed with cancer. On the first day of the conference, I had people that have been through cancer and how their relatives suffered. This brought me a great change in my life. There was a day that my father told me, I don't feel well, please take me to the hospital. We went to the hospital. The doctor diagnosed acute cholecystitis, but unfortunately, when they tried to operate him, they realized that it was intestinal cancer with metastasis in the liver that wasn't operational. That created a big disappointment to me. My whole world collapsed. So going this journey with my father, we started the best we can provide. So we went to the Hammersmith Hospital of London. I struggled with all the doctors there. I couldn't accept my father was going to pass away. And the question always was, why my father? What's hiding beneath? I never took a proper answer on that. So this became my goal, to find what's hiding behind the disease. Because my father was a healthy man, working hard. He didn't do anything that smoking, drinking, and he didn't have any history. We didn't have any history of cancer in our family. So it was all strange. So all this made me wanted to find what's hiding beneath the disease. And now it's pretty obvious nowadays, and people are more aware, that it's not enough to treat the symptom. The symptom usually is a result. I had this beautiful panel about Ozempic, and it's amazing how science strives to find technical solutions to many things. But the most important thing is to be able to guide and find what's hiding beneath obesity. What's hiding beneath obesity can be an emotional pattern, can be something, we can even say genetic, but even in genetics you can see that the family has a certain characteristic, certain pattern. And we can see that there are groups of people with certain characteristics. So for me, when it's an urgency, when it's a scientific and medical urgency, we can use medical drugs. But first, we have to find the root cause. We have to find how to guide the patient to make a change with nutrition or maybe with his mindset and his personality. So this is now a demand, and people know that and are asking to have more information about that. So this need led many doctors to speak about holistic medicine. But in fact, if you ask somebody that does functional medicine or provides supplements, what is holistic medicine, they do not know what to answer. Because holistic medicine is, the most usually answer is that it's something that treats body, mind, and soul. But when you go to the question of what is soul or spiritual awareness, this goes beyond science, and sometimes it cannot be defined. So there is a need to put some science in everything and redefine the body, mind, soul theory. So I want to drive you back to the ancient times and ancient treating systems. And because I'm Greek and also you know Hippocrates. In Greece, in ancient Greece, Hippocrates spoke about the 4 humoral elements. He spoke about the fluids in the body. And Plato, with Aristotle, spoke about the ether, the etheric energy that flows around your body and is your vital force. So even from ancient years, we were speaking about an energy field about the body. Also, in Chinese philosophy and Indian philosophy, in Ayurveda and Chinese medicine, therapists were speaking about energy. We were speaking about the yin and the yang fields. We were speaking about the 5 elements of creation, and also about the qi energy, the jing energy that runs through the meridians. So from very ancient years, we had the knowledge that there is an energy field around the body which plays a vital role. Nowadays, acupuncture is accepted, and many doctors are advising people to do acupuncture, although we cannot measure the qi energy. And going beyond that, because I practice homeopathy as a principle came from, again, the ancient years and from Hippocrates, when he said that similar cures similar. In ancient Greek, it was omnia omis isi amata. In the later years, around the 80s, Dr. Samuel Hahnemann introduced the theory of potent-sized remedies. So he discovered that the similar remedy that can treat a symptom, when you dilute it and then you vitally force it with succussions, then you increase the energy of that remedy, and as a result it has even better therapeutic results without having the initial drug or remedy inside. So he provided the information that the energy of a substance can provide equal therapeutic results as the remedy itself. So again, in homeopathy, you are speaking about certain energies and energy fields that can be therapeutic. When somebody has a distortion in his mindset, in his energy, in the way he is living, this is much similar with some archetype or certain things in the nature. So when we use the energy of this archetype, we can rebalance the energy of the patient. And that's what the message of homeopathy. And again, we are speaking about an energy field. So if we go now to what's happening now, we have professors and doctors doing research about the photonic energy of the body. So we are very proud and glad to have him as a friend, and being one of the professors that collaborating with our academy, Dr. Konstantin Korotkov, who has created a device, and there are many other devices doing similar things, but this is, for me, the most advanced and scientific proven, that can measure the photonic energy around your body. So we can now redefine holistic medicine with body, mind, and the human biofield. I can speak for hours about the human biofield, because the human biofield is an energy field that it's vital, but also it seems that it has some kind of awareness. A lot of professors claim that all the thinking and all the emotions are not happening inside our brains, but they are transmitting to our biofield, to our energy field. Some people can call it soul. I don't know if it's the soul, but I know it exists. And the thing is that the disease first manifests in this biofield through your imbalances, through your the trauma you faced in your life, through the distortion you get from electromagnetic frequencies, and all the negative energy you live around in societies. So we have to find the disease first in the biofield, and the new medicine has to take care how to treat the unseen. So the need to move beyond the traditional and complementary approaches is also very important, because traditional and Western medicine is very scientific and can be released with the symptoms when they occur in the body. Prevention is not when we have bad biochemical indicators. Prevention is go to one step beyond, and then do not have problem to manifest in your body. So again, complementary medical approaches are doing the same mistakes. You can see herbalists, you can see therapists with homeopathy fighting the symptom. So we can see that even complementary systems are trying to follow the symptoms and not trying to find the root cause. So integrating traditional Western medicine, complementary medical approaches, and technologies that can give us information what's hiding beneath the disease is very essential. So that is how humanopathy as a practice is born. Humanopathy is a combination of technologies and training around the Western medicine and the complementary medicine. Humanopathy as a word comes from two different words, human and pathos. Pathos is a Greek word about passion. We have passion for humanity. We love what we are doing. We are a team of professors, doctors, and people working on Humanopathy Academy, and we want to provide service to humanity. So there is a growing demand for humanopathic medicine because people are more aware that the way they are thinking and the way they interact with their body plays a significant role for their therapeutic journey. We have doctors like George Dispenza and a lot of other biologists speaking how you can manifest your health. But that's not enough, because to manifest your health, it's not how you project your thoughts. It's also about who you are behind. There is a mechanism working inside your mind, and this mechanism is preventing you from manifesting what you do. So telling you that you can manifest your health is half true. You have to be guided how to manifest your health. So we need Western medicine when somebody is acute or somebody has to be more intense, but we need to have also guidance to this therapeutic journey. So to become a humanopathic practitioner, you have to be scientific and you have to follow some kind of training. Usually, especially therapists and some doctors want to find the easy way. It's just following up a seminar or taking a certain small course, how you can use supplements, that you can provide a real good service in humanity. So proper training is part of what we are doing. And why it is so important nowadays to have this humanopathic approach in medicine. We can see that the technology is running so fast that we cannot even imagine what will be happening in 5 years. I saw a panel yesterday speaking about AI. AI can be a disaster or it can be a blessing. The thing is that until now, a lot of technologies are used by people that usually create disasters. But if we want to make it a blessing, we have to point out the right things that we have to be careful. And the first important thing in treatment and therapy is the personal connection. When I see my client in my office, even without speaking, by watching his face, I can understand a lot of information. I can understand a lot of things about his personality and the background. This cannot become artificial. So the connection from the heart and through your energy field cannot be exchanged with an AI system. But on the other hand, an AI system can be very helpful, providing information in seconds. A lot of doctors will find a challenge in the next years because I believe governments will take their position with AI systems. So a lot of GPs in the UK where I'm living, I think they are going to be exchanged with AI systems, and we are going to have the first level of treatment from an AI system. So being able to be more aware and try to focus on the personal communication with your patient might be vital in the future. So Humanopathy Academy is an organization that offers online courses. Online courses that are made for different professors, and you can do it in your own pace. You can follow up our training course, go on the live online courses, do your assessments, your recaps, and finally become a member of our society, which mainly we want to provide humanopathic service. I will now present you some of our courses and the reason that they are in this postgraduate program we have. We have this postgraduate diploma in humanopathy for medical doctors, and also we provide a certification of achievement to practitioners and therapists. And the first course that they have to follow up is a course on homeopathy. They are not going to become homeopathists, our students, because becoming a homeopath needs 5 or 6 years of training, but you are going to have the principles. And the principles we are going to provide you from homeopathy is to understand the remedy that is more equal with your client, and through the remedy you can understand his personality. Understanding the personality of the patient is vital because you know how his body is working. Dr. Shashi Mohan Sharma, that is presenting the course, is the principal of the Hahnemann College of London, and they are going to accreditate also this course for us. Then we have psychology. We are going to train our doctors in basic psychology principles and neurolinguistic programming. So for me, it's not proper for a doctor not to know how to address his client, his patient. Usually, the doctor is an authority, and the way he presents information to his client is programming his mind. So giving predictions of living for 6 months or 1 year, or that this disease has a certain way that it will develop, is completely wrong. So doctors must be educated how to approach the client depending to his personality. And that's what we provide with the course in psychology. We also are going to providing a course in Chinese medicine, because the knowledge in Chinese medicine and the interaction of the organs and the energy is very important, because when the symptom is manifested, sometimes it's just a reflection of another system or another organ. And you can see that this organ is overcharged when you know the personality of your patient. So Chinese medicine is also one of the courses, and is provided by this young man who is very passionate about Chinese medicine. We're going to have a course in lifestyle medicine provided by Dr. Bianca. She graduated from Harvard, and she is an amazing woman trying to serve humanity also. You know, you can understand that our lifestyle medicine is a basic knowledge for everybody, so he can guide his patients how to change their lifestyle and improve even obesity, diabetes, because as you said, exercise and even technologies and nutrition is very vital. And of course, nutrition is part of our educational system. Nutrition will going to be provided by a very important person, which will going to be announced in the next month. And then we have herbalism. We want to provide the doctors knowledge about herbs, how they can be prescribed. We also want to provide them with a biochemical type of the herb, so that they know the interaction with Western pharmaceuticals and medicine. We want also to provide knowledge about Ayurvedic herbs, and this will be another course we're going to have in the academy. And then we have integrative medicine. Integrative medicine will be provided as a course by Dr. Konstantin Korotkov. Dr. Korotkov is the creator of BioWell. He's a well-recognized person globally. A lot of the pictures that I show you is from his device, and he has huge experience, and he's going to share his experience with our doctors and students. And then it's me. I'm going to be providing a course about health awareness and medical awareness, and how this must make a change, and of course how you connect all the above information to have the right conclusions. But Humanopathic Academy is much more than a training academy. Our intention is to create a community of humanopathic doctors and practitioners. In our practice, we implement technologies that can screen your energy field, so that when you screen the energy field, you can understand where there are some deficiencies or some excessive energy points, and you have to have the knowledge to understand if this is connected with maybe a malignancy or it's just a healthy organ. And then we can have the training how to understand the personality in the root cause, and finally, we can have therapeutic systems that can rebalance your body with certain frequencies. So our Humanopathy Academy is a community of trained professionals that can share the knowledge. So after completing your course, your postgraduate diploma in humanopathy, there are a lot of other scientific community courses that you can follow up. I can give you some examples. We have Dr. Alexandra Filipovic, an oncologist from Imperial. She's going to provide a course about holistic oncology. We have Dr. Sotiris Nikolakopoulos. He's a molecular oncologist. She's going to provide a course about epigenetics and personalized medicine in cancer. We have Dr. Papandreou providing a course about the energy fluids of the body and the medicine around it, how to balance the energy fluids. We have psychologists, we have many doctors. And so when you finish your postgraduate diploma, you can follow up in different courses that we offer in our academy and become a member of the community. But we have even much more. The Humanopathy Academy has a mission. So by the end of this year, we are going to establish a non-profit organization that is going to be funded from the academy. So our intention is to create profit and funds to support a lot of humanitarian aspects. Right now, a lot of people that I know, especially from India, Pakistan, because I have a lot of connections there, are calling me that with the need to support children and communities that they are very poor and they do not have medicine. So technology provides a lot of opportunities, and one opportunity is that when you know which frequency to use for a treatment, you can just send it with an email, and with a proper technology they can do treatment or charge water. Charging water and information of water is another course we're going to provide, by the way. So we want to create funds to support communities or even create research programs. We are now, as much as we can afford, support them by sending money to buy remedies for these communities, but in the future we want to do much more. So the success of Humanopathy Academy is important for a global impact. So in Yale University there's a sign, and it's from an ancient Greek saying, Λαμπάδια έχοντες διαδώσουσι αλλήλους. This means that the ones that have the knowledge must spread it and share it with others. Knowledge that is not shared is knowledge without quality. So everybody has the obligation to share his knowledge and to humanity and serve. So you are welcome to become a member of our Humanopathy Academy. You can become a member as a student. We want collaboration with institutes, and also you can become one of our professors providing your knowledge in our academy. We'll be hosting free webinars to our community and a lot of courses if we have something to share. Thank you for your time. It was precious, and I'm very privileged to be here around you today. Thank you very much.